exactly. We need to know who our leader, or I should say, what problems our commander-in-chief may be having. We are going to bring in a physician, Dr. Zuhdi Jasser, who joined us earlier right on cue. Dr. Jasser, thanks for coming back. Here's what I want to get your thoughts on. Okay, so Karine Jean-Pierre said she directed one of the journalists in the room to tell people you can go to the one of the White House websites to get a full view of President Biden's health overview, his medical records, all of that. All right, what I want to point out here is we do know, it's widely reported in fact, that President Biden underwent a very risky aneurysm surgery after having 2 aneurysms back in 1988. We also know that he has atrial fibrillation. He has for some time. That is also widely reported. Also, it is not difficult to find out, once you look at those 2 medical conditions, that both of them can lead to increased potential of dementia over many years. So while Parkinson's is being thrown around, do you think it's more important to look at the president's existing physical challenges, 2 of which I've just mentioned, and perhaps have him go for an MRI rather than a cognitive test?
Yeah, you know, I think if you look at and talk to the thousands upon thousands of primary care physicians out there, we're the ones who typically make the diagnosis of early cognitive impairment, moderate cognitive impairment, severe, that then leads to the primary reasons for loss of cognitive function, which is usually a vague diagnosis called senile degeneration of the brain. So as much as, you know, they want to, in many ways, medically gaslight us by telling us that there's this 10-page comprehensive physical, which, by the way, I've done before as a naval officer, and I worked for Congress and doing congressional physicals and other things. You know, these things, you're very comprehensive. You make diagnoses that you know exist. But right now, there's very little known about how to specifically make the diagnosis other than doing the clinical assessment in front of you. And capacity is not 100% or 0. There's a continuum. The continuum makes a huge difference when you're talking about folks that are pilots, that are race car drivers, that are military officers, that are commanders-in-chief, executives that run major corporations. Those are the small nuances that need specific, extensive neurocognitive testing so you can make an assessment whether there is a deficiency. But most of the time, I'll tell you, most of these patients, either through family conferences or through the physician talking to them, will tell them, I'll tell my patients who are physicians, I'll say, okay, you really need to think about retiring from the practice of medicine because your cognitive function is not of the capacity in which you can practice medicine.
Right.
And I'll see them back in a month. If they don't do it within a month or 2, I have an ethical obligation to report it to the state licensing board or to tell their family to begin processes of doing that. So this is the same thing with President Biden. We're not going to find anything necessarily that's diagnosable, but we need to have the rational conversation that he's not of the capacity necessary to be the commander-in-chief.
Yeah, Dr. Jasser, that's a great point. And again, you know, you were talking about patients in general, but of course we know the President of the United States, he doesn't just need to be cognitively sharp at all times. He also needs cognitive reserve to be dealing with things globally 24/7. So we're going to have to put this on pause for now. Mike Gatto, thanks so much for being with us again. Dr. Jasser, thanks for coming back. And Barack Lurie, stay right where you are.
Okay, coming